Let's discuss difference between unfractionated heparin, low molecular weight heparin and Fondaparinux. Unfractionated heparin is derived from natural source, that is from the mast cell of porcine intestinal mucosa. Low molecular weight heparin is semisynthetic, which are derived from heparin. Fondaparinux are purely synthetic. Unfractionated heparin have active pentasaccharides that bind antithrombin 3 and long heteropolysaccharide chain which are attached to these pentasaccharides. Low molecular weight heparin has pentasaccharides, but they have short heteropolysaccharide chain, while Fondaparinux has only pentasaccharides. They do not have heteropolysaccharide chain. Molecular weight of unfractionated heparin is approximately 75,000, while that of low molecular weight heparin is around 3,000 to 7,000. Since the molecular weight has been reduced from 75,000 to 3,000 to 7,000, they are known as low molecular weight heparin. Molecular weight of Fondaparinux is around 1500 Da. Unfractionated heparin, low molecular weight heparin and Fondaparinux all have pentasaccharide chain, therefore they activate antithrombin 3, which increases the affinity of antithrombin 3 for factor 10A only. Unfractionated heparin, due to its long heteropolysaccharide chain, also facilitate binding of thrombin. Low molecular weight heparin has short heteropolysaccharide chain, therefore they have less effect on thrombin, while Fondaparinux they do not have heteropolysaccharide chain, therefore they do not have any effect on thrombin. Because for inactivation of factor 10A, binding of heparin pentasaccharide is sufficient, but to accelerate factor 2A inactivation, heparin must bind to antithrombin 3 as well as thrombin. This requires long chain of heparin. Therefore, the action of unfractionated heparin, that is, it acts on both factor 10A and 2A, while low molecular weight heparin acts on factor 10A more than 2A, and Fondaparinux has effect on 10A only. APTT monitoring is required to measure the effect of unfractionated heparin, while low molecular weight heparin and Fondaparinux they do not require APTT monitoring. To measure the effect of low molecular weight heparin and Fondaparinux, anti-factor 10A assay can be done. Unfractionated heparin is given intravenously as continuous infusion, while low molecular weight heparin and Fondaparinux can be given subcutaneously. Protamine sulfate is antidote of choice for complete neutralization of unfractionated heparin effect. It has only partial effect on low molecular weight heparin and no effect on Fondaparinux. Protamine sulfate is strongly basic with low molecular weight which are obtained from sperm of sterile fish. They are given intravenously which neutralizes heparin. 1 mg of protamine sulfate neutralizes around 100 units of heparin. They are used in treatment of heparin-induced bleeding. They are most commonly used when heparin action needs to be terminated rapidly, that is after cardiac or vascular surgery. Protamine sulfate does not neutralize the effect of Fondaparinux, but it only partially reverses the anticoagulant effect of low molecular weight heparin. They are given as 5 mg per minute IV slowly. They are used in prevention of catheter-induced thrombosis caused by factor 12 in cardiopulmonary bypass surgery in patients with high risk of bleeding. It can also be used in DVT or pulmonary embolism with concurrent thrombolysis. Low molecular weight heparin is drug of choice for cancer-related thrombosis. Fondaparinux are not preferred in patients with post-MI percutaneous intervention and stenting because they cannot bind catheter-induced thrombosis. Unfractionated heparin, low molecular weight heparin and Fondaparinux are anticoagulant of choice in pregnancy because they do not cross placental barrier. Most common adverse effects seen with unfractionated heparin is heparin-induced thrombocytopenia, which is less commonly seen with Fondaparinux. Other side effects and contraindication can be memorized by using the mnemonic A Hot Teacher. Adverse effect includes alopecia, hyperkalemia, hemorrhage, osteoporosis, and thrombocytopenia. Heparin is contraindicated in patients with thrombocytopenia, endocarditis, alcoholics, patients with liver cirrhosis, hypertension, peptic ulcer, and renal failure. Unfractionated heparin can be used due to its reticuloendothelial elimination, but low molecular weight heparin and fondaparinux are contraindicated in patients with renal failure due to its renal elimination. Thank you.